or is this going to open new
Oh.
opportunities for like acute care? We used to take walk-ins. We weren't in urgent care, but I had an orthopedic office across the hall. We would take walk-in evaluations. So if somebody needed it immediately, I could see anyone just about any day I was in the clinic. What are you guys thinking about any of that stuff?
I like that theme, because the ability for example, let's just say physical therapists that, let's just say today, they now can order x-rays in every state, let's just say. And I play weekend baseball, and I've treated like half of my team, half of my guys, maybe more than that. And let's say I'm playing and I'm there, and I see, like, I don't know, they roll an ankle, or there's a collision or something, right? Something where it's like, oh, that, like, you know, that sounded like a pop, or that sounded like something that would, or like a very common, getting hit by a pitch in the finger, the thumb, or wrist.
Yeah.
Oftentimes results in a fracture. Let's just say that specific situation or incidents. You get hit by a pitch, and it's either fracture or it's not. You know that there's no, you know, muscle tear. There's no reason initially to do an MRI, but why couldn't I just say, hey, let's go get that x-rayed, or here's a referral pad, a script, whatever. It could save the healthcare consumer. Maybe we talk about downstream, the insurance companies with getting people better faster. Maybe they would like that. Maybe they would actually spend less money and they would save money. So then the insurance company maybe makes more money, and maybe that's why they would be interested. But for my buddy who, let's just say, just got hit in the finger by a pitch, I say, hey, let's go get you x-rayed, depending on where I can get you in, or I schedule you, or, you know, refer you to somewhere. They could potentially, that patient could potentially get an x-ray a day or two or a week sooner, compared to if they have to wait until Monday morning and they have to call an urgent care or go to the urgent care, or they have to, you know, wait in line or whatever, or call an orthopod and get in later in the week. There's access, there's the component of access, there's the speed to treatment. And if there's more, if it's faster to treatment, then potentially the outcomes could be better. Maybe there's less downstream effects in terms of the insurance is looking at these patients in like a risk pool. And if we can get patients conservative treatment sooner, maybe an x-ray from a physical therapist versus an x-ray from an orthopod or whatever, maybe these patients can get better sooner. They have less issues and things downstream from that if it's not addressed up front right away. So that, in terms of speed to access, maybe there's value on the patient side to save money and time. The therapist gets to be the conduit to do that potentially. And then maybe there's even a payment upside on the insurance.
I do want to commend 3 physical therapists for talking about this topic for about 8 minutes and not using the word toolbox, because this is another tool in our toolbox. Right, guys? Number 2, where's our toolbox? But that was the first thing I thought, but I held off on saying. I was like, one of these other guys are going to say toolbox. I'll hold that out. I go back to, what is the actual value you provide, right? What are the core tenets of the things that we provide? Do I think that, you know, providing imaging is nice? Sure. Do I think it's on the periphery of what our value actually is? I do. I think it's on the periphery of the value. Do I think it's great that APTA Arizona is advocating for their constituents? Absolutely.
Scott says, I have a tool chest.
Yeah.
Scott, I'm going to say, sometimes I'm just a tool. So going back to this, yeah, 100%. Like this is this is why I have a podcast, because it introduces me to new concepts and new ideas. I can get so stuck in my own head. In my own head, I'm so used to the referrals that I always see. But, you know, Dave talked about baseball. 2 of my 4 boys broke arms playing baseball. If I could have had access to just a quick x-ray to rule out fracture, like, I would not obviously want to do things until I rule out that bone fracture for sprained ankle, for you know, impact injury, anything like that. But I don't typically see those in my clinic. Now, if I have access to it, opens up a whole new opportunity for me. What do you guys think about it? I don't know if we ever talked about it on the podcast. If we're going to talk about acute care, primary care, musculoskeletal issues, what about a walk-in clinic? You know, if are you willing to, what are your thoughts on, neither of you are really in a situation, but I have a physical location. I can take walk-ins. I've taken walk-ins. What do you think about PTs getting into that almost like a musculoskeletal urgent care. We can open virtual, we can do telehealth. I've said 100 times, if I was a parent on a soccer field, 9 p.m., I don't know if I want to go sit. The urgent care maybe is closed. That means a trip to the pediatric ER. I don't know if I want to sit there. I don't know if my soccer athlete even, has to go, or could it be something that's managed at home? I get family members that call me once or twice a month, like, hey, my son did this. What do you think? What do you think? Urgent care, walk-in, PT services?
I love it. So in terms of sourcing potential partnerships and acquisitions, we've sent letters to an Ouch Med urgent care in New York City. I think they have like 2 or 3 locations, and it's co-owned by a PA and maybe an orthopod or a non-surgical orthopod or something. So it is Ouch Med. It is literally what you just said. It's an urgent care that's like musculoskeletal only. So you don't go there if you have a cough. You go there if you have a sports injury, like an ache and pain, weekend warrior, runners, whatever. My thought, because I sent them letters and they haven't responded, and they're probably not watching this, but if they ever watch this, reach out to the Fieldmaker Group, reach out to Dave Kittle. We would love to partner with you guys or acquire or have something. And so I think it would be great to combine forces, or we talked about a hospital before. Hey, absolutely. We could absolutely hire, or we could, hire one physician if we need oversight, and then 1 or more PAs or nurses or nurse practitioners.
Yeah.
They're absolutely, or maybe kind of, Tony, I don't know, you can correct me. Maybe you were thinking the walk-in clinic is just the physical therapy clinic. So kind of like Concentra. You go to Concentra. Have you guys heard of Concentra?
Yeah.
So Concentra has like, it's a little work comp. There's the work hardening stuff, but people go to Concentra. It's like an urgent care, but then they also have physical therapists in the same facility. One of my buddies, my best man in my wedding, was a physical therapist and a clinic director at one of the Concentra locations. Patients would get evaluated, and oftentimes they'd get referred to physical therapy. And obviously it was right across the lobby, right down the hallway. That type of thing, there should be more of. And that is how, with cash pay services or more value, or more, like we talked about, how can another topic, like clinicians making more money, or having, more money in the mix with what they make, that could be absolutely a solution. A walk-in clinic, a musculoskeletal clinic, and you just, market it, you advertise it. Jimmy doesn't like it, but
Well, I'm surprised because 2 C's come to mind, right? Number 1 is cost. Like, are you in an area, are you going to get enough people with this problem understanding that you solved this problem when they need it to be solved to pay the rent, right? So it's cost and culture. I mean, I'm 44 years old. When I was a kid, we didn't know what an urgent care was. If you had a problem at 3 in the morning, you went to the emergency room. I think I was in my 30s before someone was like, why don't you go to the urgent care? And I'm like, is that what you call emergency rooms down here in Virginia? I was in grad school. They're like, no, it's like emergency room, urgent care. It's not as urgent, it's not as emergency, it's just urgent. So my thing would, you have to now change culture again. This is a walk-in, because right now culture says you go to your doctor tells you when to go to a PT. So I don't know if I would leap for this clinic, but I do like what Taco Bell and KFC have done, which is, do we need standalone restaurants? Are we actually competitors? Friend of my podcast, Rebecca Griffith, she sort of is 3 steps ahead, as she's a physical therapist in the emergency department at her hospital system, and she teaches other hospital systems why putting a PT in their emergency department is valuable, like we're talking about here, and then how to do it, how to make it ROI positive very, very quickly. So would I open up, when I sign a lease on the corner of, Madison Avenue and 76th Street? I don't know, because I would then need to create culture change, and that is hard. But the easier thing is, hey, gym owner, do you mind if I set up shop as a PT in the corner of your gym? And you're like, yeah, because that's where the people are. That one makes sense. Hey, urgent care, what if it's an urgent care down the street and you say, push this easy button right here and I'll run up the street in the beginning whenever you guys might have a patient if I'm available. So I don't know if I take the leap to opening this as a business model just yet, personally, I would need to see it work maybe in a collaboration first, because it's culture change.
So let's talk about a couple of those elements, because every one of them struck a chord with me. And I'm going to do it kind of in reverse order. So doc in a box, right? For a long time, CrossFit boxes, they were out there trying to bring PTs in. And one of the things that I talked about was, I think it was with Dave, how if I was contracted with Medicare as a physical therapist, and there was a CrossFit box that had a physical therapist who was cash based, I could do the eval, it's covered service, and we can open up a plan of care for the cash based provider. What about, and I've shared this idea, making myself available to multiple CrossFit boxes? We know injuries happen in the box. We know as a box owner, if somebody does something, an acute injury while they're in a CrossFit class, the quicker I can get them taken care of, the better. And so what we want to do is, I could be the available urgent care physical therapy provider. I could bring that person onto a virtual telehealth visit. I can rule out, really true acute cases. I can give them some information. I can direct them to an emergency room or an urgent care. But this is all premium service. So now what happens is, if I'm going to do that, to Jimmy's point, it can't be the same price as if somebody schedules an appointment 3 weeks in the future. This is a $300 to $500 service. This is a multi-$1,000 retainer, but there's opportunities there to be the true doc in the box, virtual acute care services for CrossFit, for yoga, for Pilates.
Yeah.
Going to culture, exactly the same thing. When I was the primary therapist in my physical therapy clinic, where we were across the hall from 2 orthopedic surgeons who specialized in spine care. They would have a ton of patients that didn't need surgery, but they needed some acute services. They would just walk them across the hall. Even if, and I want to share this for other therapists who are like, well, wait, if I have a full patient schedule, how do I take a walk-in? Even if I had a patient in front of me that I was scheduled for a 10 a.m. to 11 a.m. appointment, and there was an acute case that walked in, I had the facility so that I could always take that person, even for 15 or 20 minutes, a little bit of pain relief, a little bit of peace of mind. I could do an evaluation. I can show them 2 or 3 things. There was never a time that I couldn't do that. And I never had an angry patient on the other side who said, well, I booked an appointment from 10 to 11. I want all 60 minutes. But it's a cultural thing. It's, I, the therapist, am comfortable doing that. I, the therapist, can communicate with both parties to make sure that neither party is upset or angry. I could never make one of my other employed therapists do that, because they didn't want to do that. And it wasn't part of, what the experience they wanted to deliver. So if I built a culture around, hey, let's do it, we get to walk in, we're going to take them, we're going to take care of people, we're going to, open this up to multiple opportunities, I think that could be built. And in regards to, is this something that I'm going to go, full into, open physical therapy urgent care sign on the building? Probably not today, but I think it's something that people could start introducing. And if we go into the business with the mindset of, I'm not doing what's always been done because I'm going to get the results that I always got, I am going to do something different. How do I optimize for this result? And it's going to be a lot of telehealth. It's going to be a lot of, marketing to a new community. But man, if you were in the soccer world, if you're in the girls gymnastics world, if you're in any of these worlds, because you have kids in it or you have a connection to it, you see the opportunity for this all day long.
Yep.
And you instantly become the provider of choice for that.
Yeah. Meeting that person where they are, but they have to understand do you have a problem that I can solve?
Dave?
Yeah, no, I 100% agree about culture, and either you would need to, kind of like almost retrain your staff and make sure that they would be on board for this. And maybe some of them are and some of them aren't. And then, in Tony's situation or my situation, like for me, we're always going to be hiring. So the next physical therapist, it would kind of be like, hey, like, here's the role. It's the current role, this role, the established role, but then also these other things here, like for example, if we were on call for, 6 different CrossFit boxes or whatever, I agree that has to kind of be baked into either the job description of the next hire, or, you know, getting buy-in from the current, you know, one or more team members, which sometimes is possible and sometimes is not possible. And again, yeah, it goes back to culture as well.